question regarding geriatric patients in oncology. I know it's the mask. We are doing research with 1,000 oncologists all over the world. We do different kind of research, but our focus is mainly on geriatric patients and minorities as well. We know that this group of patients in oncology have been highly neglected above the age of 65. And some of the doctors in other countries will meet a geriatric patient and actually do not treat. How is COVID-19 worsening this particular group of patients? And remember that COVID is highly effective on that particular group of patients. And also we know that oncology is immunocompromising. Radiation therapy is immune suppressive. Chemotherapy is immune suppressive. So these patients and this group are at the highest risk. And when we hear all the presentation being talked about when it comes to COVID-19, nobody mentions oncology patients who are on chemotherapy and who are on radiation and sometimes HIV positive. I'm coming from South Africa. I've treated patients with low CD4 count of less than 200, and they still have cancer, and they may have TB, and they may be immunocompromised, and they may be malnourished. So there's a huge problem that we're faced with. And in this current phase, I feel we are neglecting the geriatric patients, and they are more prone. And what is your take on that?
I guess that question is for you.
Thank you very much.
It's for you, definitely. I didn't want to mention you by name.
Just so that we're clear, I promised two people to quickly get their questions.
I'll jump on and carry on outside, but thank you so much for the question. I'm so happy you brought it up. And know that it is a very important current situation in regard to the different groups. You gave an example of the geriatric, but of course there could be many others. You mentioned another one, which is living with HIV, and no doubt that these are very important tasks that we are obligated to take care of. We proudly actually published on this just last year, I believe. Yeah, it came last year about actually referral patterns in regard to patients with cancer living with HIV in Africa, and it was published in Geriatric Global Oncology. And if anything, we're trying to kind of like really ultimately trying to discern what are the key elements. It's not age, it's actually performance. And as such, we are obligated not to look at patients by age and decide we can or cannot get therapy. It's all by performance per se. And too many variables per se, among which living with HIV. As you said, CD4 count can be a critical component. It's not the HIV status, it's more about the CD4 count. And we should not necessarily look at patients living with HIV any different from taking care of. Actually, I sit on the steering committee of the NCI AIDS Malignancy Consortium, and this is one of the jobs that we do is to take care of the patients living with HIV with cancer. And you're absolutely right, these are important tasks that we're all doing, but I can assure you, yes, there are things being done at the moment.
Let me just again for you. I predicted a couple of years ago, a few years ago,